American doctors are finding themselves in a dilemma. The changing healthcare market is causing many to give up private practice and take salaried positions with hospitals instead. Dr. Kathleen London writes in the New York Times, quote, "I think the days of what I did in 1999 are over. I don't think that's possible anymore." The woman who wrote those words, Dr. Kathleen London, joins us now. Over why?
It's a very different environment, and it predates healthcare reform, so I want to make that clear. And it started even in the 90s when I was in residency. We had at the facility that I was at in Oregon, we had somebody solely doing referrals because he needed to get insurance. Every insurance company is different in what they require when you order an MRI or you order, you want them to see a consult, a specialist. Fighting to get paid. I mean, some of the stories I could tell you from when I was in practice were insane. So we're talking back even in 2000, where the private insurers all have little games to keep your money. You pay your insurance company. They want to keep your money as long as they can to get interest and whatever on it. So they'll play little games where they will automatically reject a claim. So here I am, a small physician in a small practice, trying to get paid for a service I did. And just like when you go to call your insurance company, you're on hold for a really long time. So are we as providers. So that means one of my employees is sitting on the telephone while I'm still trying to treat patients and take care of them. So you end up as a small provider with a staff size you can't possibly support. So I got to a point where I was either going to have to grow very, very large or take a position, and I opted on the latter.
So you spent your time in med school studying the human body,
right,
not necessarily earning an MBA, for instance.
Exactly, and that climate is changing. So it used to be pretty simple, like, it wasn't all these games. In the old days, you submitted the claim and they paid you, which seems pretty fair to me. I saw your patient, I treated them, just pay me for what I did. But to have a claim rejected, one example, because we have to code, is, I saw a patient, so there was an office visit in menopause, and they tried to tell me that diagnosis and procedure don't go together. Really?
Yeah. But, what does it mean for, say, small-town America? I mean, you're not going to have, if there's a one-doctor town, or even several towns that share a doctor, that doctor's not necessarily going to be ally himself or herself with some big corporate entity.